Just a little brief intro for Carly. She is a registered dietitian and menopause support coach with over 14 years of experience. Carly is dedicated to empowering women through menopause by providing evidence-based nutrition, education and coaching on safe weightlifting practices. Working within a busy acute NHS setting for 10 years, which included critical care and acute surgery, Carly was inspired to use her experience of treating disease-related malnutrition and sarcopenia to support promotion of physical and mental resilience within her coaching business created in 2020. As the founder of the Strong Bones Club, Carly offers online coaching and small group training tailored to each woman's capabilities and goals. Carly's unique coaching approach is grounded in 3 core pillars: move, connect and nourish. This holistic focus enables women to better understand their movement, relationship with food and mindset, allowing them to confidently make transformative changes and embrace their best health and fullest selves. Carly helps her clients achieve success through maintaining consistent strength training routines and adopting a positive mindset to overcome body preoccupations and leave behind the dieting mentality that steals their joyful moments.
Yes, thank you for that introduction, and thank you to Claire for covering such a holistic presentation as well. So hopefully you can all hear me okay today. So like I say, as a coach I now want to cover the benefits and the impacts of exercise and how we can holistically support menopause through balanced exercise and nutrition. And you'll see the mention there of Strong Bones, and I'll explain to you why I want to cover that off. So just to run you through what I want to go through today. So we'll run through a brief recap of osteoporosis, just to jog the memories of those not working in the field on a regular basis, and going through menopause and how this presents in osteoporosis risks, impacts there, and is it too late to change? And you'll see why I want to ask that question. And then we're looking at how we integrate nutrition, mindset and movement together, and I have a very wonderful case study that my client is very happy that we are sharing this today. And of course I want to leave you with a few practical tips and considerations to take forward into your practice and to make this a more practical and usable presentation as well. So there we go. So I've had a wonderful introduction already, so just introducing myself again. So starting as a dietitian in 2009, had quite a varied career through the NHS for over 10 years, working within ICU, critical care and lots of surgical experience as well. And it was through seeing the impacts of muscle loss and bone loss and loss of function throughout the ages and stages of life that really wanted me to leave the space and bring together the dietetic skills with exercise coaching and lifestyle coaching as well, because I could really see the struggles that many healthcare professionals go through as they want to implement holistic advice and sometimes can feel like they are unable to do everything they would love to do for their patients, even working together in the best way. So this is absolutely just an extension from the work I did within the NHS and bringing together my passions for fitness, strength and nutrition together. We love technology. So why Strong Bones? So we'll go through this. So with so many impacts of osteoporosis, we can see how we would want to start covering this. Now, you might not see the topic of osteoporosis brought up all too often in the media. It's not really the sexiest of topics, is it? It's something that's far away in the future. We might not get it, and we've got to go through a lot of discomfort for something that we might not see the results of. But as you can see, the results are very wide-reaching and impactful, with 1 in 2 women over 50 affected, 1 in 4 men as well. So yeah, there is that gender gap. And when you have a 10% mortality of a hip fracture in 30 days and this 5 years, 20% risk of loss of life, this is incredibly impactful and very important, but unfortunately often left to the last minute to start to address, something that can be prevented. And of course, with a cost of 4.5 billion annual cost to the NHS and 200 million people worldwide affected. For something that is a preventable disease, any diagnosis is just not acceptable. So the silent condition, so as we say, we don't know what's going on under the skin. We can't see what's going on. We don't know what our bones are doing right now. So often with this silent disease, the only time we start to find out is that silence is broken with a broken bone. And again, is it too late at this stage? We will cover this, but I'm just going to go through the process of bone remodelling. Just a little recap for you. So again, we have that first stage, the activation. So we have damaged or impacted bones. So this can happen when we are exercising. Also, if we have knocks, bumps, scrapes, even walking. So our impact is coming through the bones in our heels on a daily basis. So walking is a great thing to be doing. If we're bumping our bones, if we're doing karate, boxing, all these things that impact us, these are all opportunities for little amounts of micro damage to the bone. This also then encourages the osteoclasts to start breaking down those little parts of damaged bone, and that reversal effect of the osteoclasts coming to lay down that new bone. So the healthy bone remodelling just helps us to break down and lay down new bone tissues over our whole life cycle. So when we start to see the differences happen, so as you can see in the early years, this happens very nicely. We have the opportunity there for regular bone breakdown and build up. We have the opportunity for the bone bank to be built so it can be strong and resourceful, and we have the opportunity to build a high level of peak bone mass. But as you can see, there's some discrepancies start to occur when we get to the ages of 25 to 30 in women. This is where you'll start to see where this discrepancy happens. So again, you see that men have pretty much a 10-year delay on their breakdown and their loss of bone mass. And with females reaching peak bone mass at 25 to 30, but most women only are getting diagnosed in their 70s, you'll see there's a real lost opportunities here to build that bank of bone mass, and often very much too little too late when the diagnosis is already made. And it can be easy to feel that there is some fault here, but we must remember that at the time that we've been born and the context of the world we live in right now, unfortunately women have not been encouraged to exercise. We've not felt we had a place in the weights room. We've often been told, especially the slightly older generation, but really very much my age and beyond, have been told it's not ladylike to sweat, and been given very little instruction or unhelpful instructions. Me personally, having been told to only lift light weights in my teenage years, where there was plenty of opportunities to build that muscle and bone bank. And so we've often been discouraged, we've often been exposed to diet culture, dieting, the promotion of very thin, unrealistically thin body shapes. So you can see that at these crucial years, we've been told to break our bodies down, not build them up, and left to suffer a very debilitating condition in later years. So I'm here to address that and hopefully to inspire you to pop this up on the agenda and get this more seen and heard. Okay, so we're going to talk through the role of estrogen in bone health. So as you'll see, we have estrogen receptors all over the body, and these are responsible for joint lubrication, which can help with ease of movement and keep pain at bay as well. And as you see, as we go through those stages of perimenopause and menopause, this is where it starts to drop off. You can start to see the slowdown of muscle protein synthesis, making it much harder to regain or gain muscle, whether it's lost or never being built in the first place. And it can be quite a misconception to believe that estrogen is just in the ovaries, but yes, it's in the brain, the bones, the muscles. So it has body-wide impacts when we start to see those drops, especially from mood and motivation perspectives as well. So then there you have a further barrier to exercise. And again, it also stimulates the bone growth. So in those younger years, when we have plentiful hormones, we're able to build those bones and those muscles with plenty of activity, plenty of strength training if it's done with supported nutrition. So we have plenty of opportunities to develop that. And again, it's not entirely impossible once these drops occur. And just remembering as well that we do have advances with hormone replacement therapy to try to bridge that gap and to slow down those losses at the right time. But it all relies very much on awareness and action taking, to make sure that especially women are aware that they can access this help and to be fully informed so they can make the right decisions for them. Because as we know, the media is not always the most helpful in that decision-making process. So as health professionals, it's so important for us to gather this awareness and knowledge so we can share it and help and provide informed decisions for everyone that we are in contact with. So just to show again how the impacts of estrogen are changing over the life cycle. So we have this drop occurring around sort of the age of 40 onwards. And again, with the progesterone levels, we get further impacts of menopause as well. So you can see it starts to fluctuate just at that age when the bone mineral density is starting to drop off as well. So it just shows that how connected this is with our ability to build and sustain bone mineral density. So we're going to talk about this then. So I've already said that actually most of our peak bone mass has been developed by the mid-20s, and also there is studies to show that up to 90% of bone mass is actually formed in the teenage years. So is it too late? Once we get to menopause, have we missed the boat? So I'm going to talk through some barriers and opportunities here. But just to highlight, there's just such a number of menopausal symptoms. You may be familiar, and I won't read them all out today, we might be here all day. But just to highlight actually how many of these impact the ability and the want to exercise. So is it any wonder that we start to struggle at this age if we don't already have a positive association with exercise, with strength training, or with joyful movements? Then adding these impacts such as vaginal dryness, discomfort, dizzy spells, fatigue, muscle tension from stressful events and through loss of hormones, it's not surprising that no one really feels like going into the weight room for the first time during this stage of life. So there really is the emphasis for early action here, but we can still very much offer support. Okay, so is it too late? So as I said, 90% of bone mineral density acquired by the age of 20, and we start to see that decline through strength, through loss of muscle over the ages from 45 to 52. And that is those changes in estrogen, testosterone levels in the body affecting ability to build, but also the mood impacts and energy impacts as well. So a great amount of fatigue is often experienced in ladies at this sort of age, as well as coupled with the fact that we have a lot of life circumstances. They may have teenage children or grown-up children, perhaps grandchildren, all pulling upon their time, energy, and again, they may be quite advanced in their careers. So again, if they've been building up a career, they may feel very much stretched. So it can feel like adding just another thing onto that plate that's already very full can seem beyond possible. And again, there's that earlier onset of menopause. Again, we're starting to recognise with recognition of all of these symptoms, where it used to just be hot flushes and loss of periods, but now we're aware of over 40 impacts and experiences that now we're identifying menopause at an earlier stage, which is really positive because it means we can take some earlier action. But actually the studies have started to show that that date of that last menstrual period, that final menstrual period, is actually a greater predictor of osteoporosis than chronological age. So it's really interesting to learn that. Again, it can highlight our awareness here. We can start taking that action at an earlier stage with a more informed choices going forward. There we go. So, as we said, has the health ship sailed for menopausal women? So it might feel like it has. There's a lot stacked against us. May have never done any health promoting activities before, may never have touched a weight before. So is it too late to start? I know you know that I will be biased, but of course not yet. So again, exercise training actually can improve bone mineral density, especially in the femoral neck, lumbar spine, and the trochanter in older postmenopausal women. So some really positive studies coming through, and it's just so great that these studies are even being done. So it's great to see that. So there is possibility of halting the progression of osteoporosis, and again, if caught early enough, potential reversal. Again, we also have that exercise can prevent falls risks. So again, not a very sexy topic. I mean, it is to me. I mean, I love it, but I know that it's not really catching the eyes of the papers all that often. So again, but when we talk about falls risk, yes, it might not mean anyone's winning any trophies, but not falling over your dog when it gets under your feet is priceless when it means that it prevents you from having a broken hip. So of course, and that's a true story, one of my clients. So yeah, of course, we want to prevent falls. We also want to be promoting that well-balanced diet, making sure it's sustainable, suitable for individual needs as well. As Claire had said, there's no one best diet. There's lots of healthy diets, and sometimes as dietitians we are the best suited to making those adaptations when we have very specific clinical conditions and experiences in front of us as well. So I'm not going to list all the things that we help to treat, but I gave a few examples of celiac, inflammatory bowel disease. These all actually increase the risks of osteoporosis, and we are very well placed as dietitians to support with this. So finding strength in later life, a case study. So I'm going to introduce you to one of my clients who's very excited that I wanted to include her in today. So meet Rosalie. So here she is at the gym and she comes to see me. I'm going to tell you a little bit about her story and how we've used some of these evidence-based practices to support her. So as you can see, she's 75, so very much past the age of peak bone mineral density, very much past the age of menopause, no longer sort of an option for her to have HRT, and also with a diagnosis of chronic kidney disease at stage 3, she has been informed that the medical treatments and medications for osteoporosis are not deemed to be suitable for her. So again, we're very much looking to those lifestyle and diet and exercise impacts to support her. So she had a history of having a weekly Keep Fit classes. So these were aerobics based, very low impact. She did that into her 50s, but she's very much come from the age of not doing too much activity, keeping yourself nice and slim and making sure that you don't get too sweaty. And that was her view of exercise and throughout the majority of her life. But this all changed when she got her diagnosis of osteoporosis and she started to want to explore ways in which she could help herself to walk unaided and pain-free with confidence. So she was one of these ladies that sailed through menopause. So this is another area where I really want to raise awareness because, again, we were told, hot flushes and that was the menopause and then your period stop and that's it. But actually, when we think about it, as much as I don't wish these difficult symptoms on many ladies, actually, we can see these as really helpful markers and really helpful signs that we can start to take that action earlier. Because for Rosalie, she had no symptoms that she was aware of. So, she may have had symptoms that she didn't know about, but she deemed herself to sail through menopause. But unfortunately, the next thing that she knew that was any sort of impact of her menopause and declining hormones was that she was found to have an incidental finding of fractured spine. So she had lots of chronic back pain, found herself finding it very difficult to walk without pain, found herself becoming very inactive. And like I say, we found that there's fractures to the lumbar spine and the pubic rami. So it's a very upsetting diagnosis for her to realise, having not been aware of any health problems apart from her kidney disease. So again, this has some real life impacts for her. So 2-year period of immobility. So at the age that she is now at 75, very susceptible to sarcopenia, very susceptible to loss of muscle mass and difficulty to regain that as well. So highly dangerous for her to be coming across fractures. Again, it's limited a walking distance, so only less than 20 metres able to walk. So very impactful on her quality of life. And she was somebody that was very active. She liked to go shopping. She liked to go around the garden centre. This was all not possible for her to do without many days of pain or sometimes impossible to complete at all. So she had a very high daily pain level, and as we talk about wanting to live for longer, what we really mean is we don't want to live for longer in pain and struggling and not being able to live the lives we want. So this is something that's highly important to improve for her, to have a long and happy life. And again, we have that cardiovascular deconditioning, so impacts on the heart, the lungs. So again, aside from the bone health, actually, because she was unable to move without pain, she didn't want to move. And of course, we know the impacts when we have reduced cardiovascular capacity on longevity and length of life. So again, highly important to start to improve this so she could start to enjoy her life again. And with all that, high levels of fatigue. So we wanted to help to reverse this and improve and see where we could get to with lifestyle, exercise and nutrition. So I'm going to take you through some functional tests that we had a look at, because again, just using the scales in this situation, as much as she did express a little bit of a fat loss goal, as many people do, even if it's not a priority, we decided actually the best thing to be looking at for her was how can we improve her life, and if a small amount of fat loss occurred, that was appropriate for her, but also reminding her of the stage and age where she is, where weight loss and large amounts of fat loss not really recommended, as she was not in a dangerous position from a body composition point of view. So we had a look at hand grip. Okay, so we found her to be in the less than 85th percentile for her hand grip. And her mid-arm muscle mass, this was all appropriate. So she wasn't malnourished, so she was in a good place from there. So we had some good things going for us here. And we did a timed up and go, which is where we actually got her to get out of a chair, walk 8 metres, turn around and return. So this took her 20 seconds. Now anything over 12 seconds is deemed to be a risk of falls. So here we have a highly risk of further falls here, and we know she has some severe osteoporosis in parts of her body that's going to be very dangerous for her should she have a fall. So really important to address that for her. We had 30 seconds sit to stand. She did quite well with this. She got out of puff, but she was able to complete standing up and sitting down in a chair more than 5 times. So we deem this to be appropriate for her and a good level to start from. And again, we did a 2-minute march. Oops, when it comes up. Which she was unable to complete. The clickers broke. I'll catch up. Okay. Did you? Okay. Okay, so she was unable to complete her 2-minute march, and nutritional intake showed that she had a low protein intake and infrequent meals, so she wasn't a breakfast eater. So, you think we'll be able to get there? Ah, right, yeah. I'll give a little nod, yeah. Okay, so what did we do then? So, can I make that happen? Oh, there we go. It's working again. Good. So again, as we mentioned, I have my 3 coaching pillars: move, connect and nourish. So wanting to make sure that daily movement is part of her life, that we're connecting with self and others, and you'll see why this is next, and also appropriate nutrition for her, so including all these 3 areas to ensure holistic help for her, because as you can see, it's not just one thing that's going to contribute to her improvements. So in terms of movement, we followed the Strong, Steady and Straight guidelines, which are from the Royal Osteoporosis Society. So again, when we're starting a training program with somebody at such high risk of falls and has a risky condition which has massive impacts and potential for debilitation should she have an accident, and during our training session we had to really make sure we were mindful of this. So looking at strengths, we chose to use free weights in positions that supported her body that she was already able to do. So this involved things like, sorry if you don't know much about exercise, but things like single arm rows, so where we were moving the arm muscles, focusing on squeezing those muscles and becoming aware of how her body moves. We looked at doing squats, so the sit to stand movement, very important, especially as we age, because getting in and out of a chair, getting on and off a toilet is highly important for the rest of life. We want to be able to do that for as long as possible. So focusing on these types of movements that were very applicable to her daily life, to activities that she liked to do, was incredibly important for her. And again, steadiness, very important. Again, this lady who's at risk of falls, and as many people are, and when we already have osteoporosis diagnosed, falls risk is absolutely imperative and a big focus. So we focused on how her feet were touching the ground, so her proprioception around walking, so heel to toe movements, making sure the steps were steady, and also making sure supports were available where needed. So we really focused on doing breath work to help her keep calm and improve her confidence. And we did this sort of next to walls, next to things you could hold on to start with, as she started to improve and to build on her confidence with walking, because she did start this with using 2 crutches for her walking, so it was making sure that she could perform a few small steps without aid, and we reduced that gradually over time. And again, keeping the spine straight, so particularly for Rosalie, because she has fractures to the spine. This is a very high risk movement when we have spinal flexions. This is where we are bending the spine forwards. It's basically a movement and a posture that many of us have on a daily basis when we're using computers, when we're driving. It's essentially our go-to movement most of the time, and thank you to those of you that just sat on a bit straighter. So love to see, putting in practice straight away. But yeah, it's such a habitual movement that actually needed to be addressed. And we did this through focusing on the hinge movement. So that's the ability to bend with a neutral spine, to pick things up off the floor, and making sure she wasn't using too much spinal flexion when we were doing any of the movements. And even with sitting down and standing up, you'd be amazed if any of you work with elderly people, or if you've seen how they get in and out of chairs. Sometimes there is that throwing the self forwards to get out of a chair if the leg strength isn't there. So we were very mindful of not allowing that movement and making sure the spine was protected whilst building that muscle strength. And all this off the back of improving confidence as well, which is where the mindset techniques come in as well. So we will cover those. So again, nutrition, so Mediterranean diets already had some attention. So as it's been said before, there is no one best diet. Again, the Mediterranean diet is recommended throughout some of the literature that's there. However, it's healthy eating, balanced eating, ensuring sufficient calcium, sufficient vitamin D intake and exposure from the sun, and supplementation where needed within the parameters recommended in conjunction with the medics that she's working with as well, and just with her impact of her kidneys at the time. But the reason I like to just show you a quick picture of this Mediterranean diet is because we can see that the recommendations here of the regular physical activity, adequate rest, and making sure we're having that community aspect as well. So we have those lifestyle, community and connection aspects when we're considering nutrition, because I think not enough attention is given these days to support in the eating environment, who we eat with, how we eat. We're often in that rush culture of just getting the food down. So I think it's really important to bring this back and give that some attention as we look at the composition of diet, but also the environment in which we are eating and which those around us are eating. This is something we can certainly encourage with our own patients as well. So again, so this is what we did with Rosalie. So just a brief recap on what we did together. So we encouraged weight training. She did that with me once per week. We had access to weights and supervision, so we can make sure she's moving appropriately. And then we chose a few select movements that she was very confident with, that she could continue to do at home, because I have those recommendations of weight training 2 to 3 times per week. Now for her, in terms of aerobic activity, we stuck with the marching, and we just worked within her own parameters. So 150 minutes for her, maybe a bit steep to reach, but she's working her way towards that. And again, daily mobility, so keeping mobile, keeping gentle flowing movements going on a daily basis. So this was programmed for her as well. So in terms of connection though, because again, a lot with movement, confidence can come into this, especially when hormones have changed. There can be a big loss of confidence over those menopausal years, and sometimes this isn't regained. So we focused on daily gratitude, and this is to bring about a positive association with aging. Some deep breathing practice, again, very important, particularly when there's been spinal fractures or anything around that thoracic area, and making sure breaths are able to continue to be taken, but also from the stress relief side as well, because like I say, we want to reduce inflammation, and managing stress strategies is one way in which we can do this. Again, making sure she's taking meals with others just to help support her nutrition intake, and getting those outdoor walks and enjoyment of movement through trips to the garden centre. Again, for her, we increased her protein intake. We included breakfast in a way that she could manage. So she was someone that never took breakfast apart from a piece of toast, so she could take her tablets. So we found some easy strategies for her. So we focused on having some Greek yogurt and the occasional milkshake, so she could have something and start to get that additional opportunity in for protein that she was highly missing to start with. So again, it's a step-by-step approach. You know, we have our guidelines and we have our ideals, but we're very much working with real-life people who may be a long, long way away from those. So as much as we have those in mind, we want to make sure we take that step-by-step approach. And again, we ensured that she was getting sufficient calcium, vitamin D dosages that were in line with her recommendations. So the results. So again, we had improvements to hand grip. So again, we now exceeded that 85th centile, so a very small amount. She's on the cusp, but it improved. Mid-arm muscle stayed the same. Again, we reduced that timed up and go from 20 seconds to 8 seconds, so no longer in that falls risk category, which was so important for her. And again, the improvement in the sit to stand, so she's already in a good range, already in appropriate range, but the fact that she could add some of those additional sit to stands just shows that increase in fitness and strength. And she took a lot of enjoyment out of seeing these parameters change as well, because again, a lot of this takes place under the skin. We can't always see these impacts, but she can very much feel them. And again, after unable to complete the 2-minute march, she's able to do 82 marches, so quite an improvement. That was over the space of 2 minutes, so fitness-wise and ability to sustain some stamina meant that was having her enjoying time around the garden centre without feeling too puffed out, reducing her enjoyment of that activity. So again, got adequate protein, so we managed to achieve some protein targets that we set, and she was able to achieve this 3 times per day, so improving from the inadequate 2 meals per day that were below recommendations to 3 that were meeting that. So some improvements there, and she's always very proud to say that she was achieving those as well. So practical tips for yourselves. So I'm going to cover a few areas that I think we would benefit from continuing. And it's good to see, I think we may very much be in line with what we've on the same page today, which is always good to see. So again, self-compassion is really important here with associating with positive body images, because again, we're asking our patients and clients to take self-supportive action on a daily basis. We want to help them to understand why that is, and if they're coming from it at a place of self-compassion, whether they have that day when they can't get all their actions done, or whether they're trying to make that switch from a highly weight-based focus to a more health-based focus. This is where we can help them with that. Again, a meta-analysis of exercise and body image, and found that the exercises did have that higher body image score. So again, it's just continuing to promote the benefits of exercise, and again, not just from the weight-based focus, but for the whole body health focus, and through the improvements in well-being as well. So feeling good over just that perception of looking good. And again, making sure we're having a look at the food and body neutrality, supportive nutrition rather than restrictive nutrition. So looking at it from that point of view, because you'll often have noticed throughout your careers, you may, once it's discovered you're a dietitian, you may be asked what people shouldn't eat. And of course, we're always looking at that inclusive approach of actually what we can add in and what can be included in the diet. So supporting patients further. So again, making sure we're choosing our foods within the guidelines and what supports the body. Encouraging daily movement, just keeping this simple. And again, so look to build your network as well. So what have you got in your local area, or within your area, and how you can be supported? Because we know that we have our own specialities, our own scope of practices. But we know that with this being such a holistic thing, there are definitely other professionals that we can link up with, whether that's physiotherapists, psychotherapists, whether that's other coaches as well. I've had many good experiences as a dietitian in the NHS, linking in with your patients' own personal coaches and being able to pass on those evidence-based dietetic recommendations, with the coach being there to help with the implementation in the long term. So it's an absolutely beautiful partnership that I think we should look more towards creating more of these scenarios and situations. It's great to be at a an event like this today. And again, making sure we can do that proper signposting as well, because we know we can't do everything. No matter who we are or what we're doing, we can't cover everything. So it's starting to link in and work together more. And again, making sure looking after your own self-care. A message today, that's for you. Again, if there's anything that you see that you can improve, those little areas as you're busy, what you can do for yourself to keep positive and looking after your bone health. Because it's never too late or too early to take care of your bone health. So thank you very much for that. Okay.